Dear colleague, let me introduce my presentation, Assessment of anti-pro-BNP during labor depending on pain relief methods. Negative emotion and mental stress in parturients in labor with severe pain affect the cardiovascular system, causing microcirculatory complication and reducing peripheral blood flow. The study aims to evaluate the dynamics of anti-pro-BNP depending on the technique of epidural analgesia in labor. A total of 90 parturients were evaluated in our study. All parturients were divided into 5 groups with different concentration of levobupivacaine. The first group was on manual boluses. The second was on patient-controlled epidural analgesia. The third and fourth groups continue on epidural infusion with patient-controlled epidural analgesia with different concentration of levobupivacaine. And the fifth group was program intermittent epidural boluses with patient-controlled epidural analgesia. Anti-pro-BNP registration points were before analgesia, 1 hour after the onset of analgesia, and in the second stage of labor. As you can see on the first line graph, the mean anti-pro-BNP level was increasing significantly during the observation period in the first group. Similar dynamics of anti-pro-BNP was observed in the second group. The anti-pro-BNP level was also rising over the observation period in the first groups. However, 1 hour after the onset of analgesia, its level was not as significant as in the first and second groups. The downward trends in the median of anti-pro-BNP in third and fifth groups was registered 1 hour after the onset of analgesia, although it had an upward pattern in the second stage. According to the comparative intergroup analysis, the highest initial average level was observed in the first and fifth groups, whereas the lowest average level was recorded in the second groups. 1 hour after the onset of analgesia, we register fluctuating dynamics of anti-pro-BNP. In the second stage, the average level of anti-pro-BNP increased significantly in the first, second, and third groups. In conclusion, the mean values and variability of anti-pro-BNP level were within normal reference interval through the study in patients in all groups. The use of combined technique of labor epidural analgesia with a low concentration of local anesthetic prevents the decompensation of the parturient's hemodynamics as labor progresses to the finish. However, the main reason of an increased level of anti-pro-BNP is associated with a rise in tension and contractility of the myocardium as well as with strength and frequency of uterine contraction. With each uterine contraction during labor, venous return to the heart increases by 20%, resulting in the release of INP, BNP, and anti-pro-BNP into the circulation. An additional mechanism which involves the production of natriuretic peptides can be increase in oxytocin levels. According to the author F, a significant correlation between oxytocin and anti-pro-INP levels was observed in the active phase and 15 minutes after delivery. Thank you very much for your attention.